I'm a cardiologist, which is a heart specialist. My area of subspecialty is in heart failure and heart transplantation. Heart transplantation has always been deemed to be the gold standard or the most definitive treatment for the management of end-stage or advanced heart disease. But increasingly, we have now the availability of a ventricular assist device. This is a mechanical pump that can be surgically implanted into the body of a patient with heart failure. With the assistance of this device, the general quality of life of the patient with heart failure, as well as the patient's survival, will be greatly improved. And this is a form of newer treatment that's available now in our hospital. A month ago, I had a foreign patient who was very sick from fulminant myocarditis. This is a condition where there is inflammation of the heart muscle, leading to heart failure. And this patient from Indonesia was on the verge of death. He was evacuated here in an air ambulance. Fortunately, after treatment in the intensive care for about 2 weeks, I was able to get the patient well enough to be discharged from the hospital. I was happy to see him again yesterday. After evaluating him, I found that his heart has fully recovered. So it's happy instances like this that remind me that how much we can do for our patients. Not just to make them feel better, but give them a normal life back. So Farrer Park Hospital's mottos of comfort, fairness and value, I think, are very valid points. In medicine, we may not be able to cure our patients always, but we must always comfort and make our patients feel better. In terms of fairness, I think that's in the healthcare business, it's a business. There has to be a profit made, but I think there's a difference between profit and profiteering. So a certain amount of fairness to patients and to the healthcare providers, I think, is a valid concern. Then lastly is the question of value. When we're providing care to our patients, I think value should not be measured in terms of monetary terms, but how much we are providing to the patient. If we can provide compassionate care beyond just competent providing medical services, that's where I think the value is. We want to have caring medical professionals, doctors, nurses, physiotherapists, and very compassionate ones at that.